Sure. The brief overview really is that it's a translation study and it's trying to scale up a randomized controlled clinical trial from the NIH with the CDC kind of converting it into this public health initiative. And so the main goals are training lifestyle coaches, having quality programs confirmed by the CDC recognition program, and then marketing and promoting the programs to enroll participants that have prediabetes or other risk factors for type 2 diabetes, and making sure that we're monitoring outcomes and kind of sharing those results. So that's part of what we're doing here at this meeting. Yeah, a little bit about the story behind it is the DPP is really designed for people with prediabetes, so they're at risk for type 2 diabetes. And our lifestyle coaches in Montana were saying they're kind of being innovative at the local community level and kind of breaking the boundary of our traditional criteria and saying we have a lot of patients and providers that want to refer people to enroll in the DPP that have type 2 diabetes, because we know that lifestyle changes are this background and foundational treatment recommendation, especially for newly diagnosed. So over the course of the years, from 2008 to 2016, we ended up enrolling 105 people with type 2 diabetes into the program. So it wasn't the primary enrollment goal. We enrolled close to 9,000 people with prediabetes. So this was a small sample of the overall that were served. But we noticed that the average age was middle-aged adults, so around 55 years old. Most enrolled were women, I think about 60%, and they attended the classes really well. So there are 16 core sessions, and the average attendance there was a little over 12 sessions. And the entire year-long program is 22 sessions, and the average enrollment was about 14 and a half sessions. So they did really well doing that. And then the outcomes that they achieved were really comparable to people with prediabetes. They had great achievement of the physical activity goal. I think about 2/3 of the participants achieved the 150 minutes per week of moderate to vigorously intense physical activity. And then we really noticed through our findings that meeting that physical activity goal and keeping track of what you're eating for almost the entirety of the program were the two biggest factors for achieving 5% weight loss or the 7% weight loss goal. And just under half of the group achieved 5% weight loss, and about a third achieved the 7% weight loss goal, which is the overall program goal. So I think we really would conclude that even though it's designed for people with prediabetes, that people with type 2 diabetes can successfully participate. They can lose weight, and that might even contribute to what evidence shows as diabetes remission through that weight loss. I think two huge encouragements are having accountability with a lifestyle coach that's motivating them and supporting them through this program, as well as the referral of their primary care provider, so really trusted individuals with expertise in diabetes or prediabetes, nutrition and physical activity, and also kind of coping and life skills. And then also peer support. So other people that are facing these similar challenges, they're participating in a group class. And I think the community around them, whether it's their family, their friends, their coworkers, kind of everyone playing a role in keeping them to have these healthy lifestyle changes, because they are such a big commitment to make. I think overall it's just amazing to see the whole world really come together to acknowledge all the late-breaking and new advances in diabetes. And some of the sessions I like to go to most are really about pragmatic clinical trials and translation. I've been going to a lot of the diabetes prevention program presentations, diabetes self-management education, and then I think the awardee lectures are always really inspirational because they're just these huge leaders in the field. So I think we've seen a lot of the results really, whether it's public health interventions or clinical interventions or research that's looking at cellular mechanisms of the pathways that different hormones are taking place. A lot of it does come down to the takeaway is healthy eating and being active. So we feel like this program has a really good fit with those messages, which is always kind of rewarding to go back to our work in Montana and know that we're kind of practicing that and making it happen